attention to coastal towns because they are undeniably among the most beautiful places to live in Kent and Sussex, and for many people living by the sea enhances their quality of life. But coastal communities face serious challenges, in particular around health, the quality of housing and the reliance on seasonal jobs. In a rare interview, England's Chief Medical Officer Chris Witty told us it's time to reinvent coastal towns for a new era. Later in the programme, we'll be hearing from people who live in Thanet and the Isle of Sheppey. But first, our political editor, Charlotte Wright, has been finding out why Hastings and St Leonards have some of the lowest life expectancies in the southeast.
For decades, people have flocked to the coast in pursuit of the sea and the scenery. But for many, day-to-day life in these towns isn't easy, with high levels of deprivation and deep-rooted social issues. Emily and Jonathan live in a two-bed flat in Orr in Hastings with their 5 children. Unable to earn enough to rent privately, they're on a waiting list for bigger social housing. It's a situation that they say impacts their physical and mental health.
Being squeezed in such a small place and the rent keep going up so you can't get anywhere, and people refusing to have you if you have too many children or without having a guarantor. It's stressful because you want to give your children the best life possible as you can, and then you feel like you can't, as if you're failing.
Struggling because I can't give my kids what they need, and we don't have the space that we need.
This summer, a report from England's Chief Medical Officer says issues such as overcrowded housing, a lack of quality education, and a reliance on seasonal employment are contributing to the ill health of people living in our seaside towns.
With many of the towns around the coast, what they have is they were centred around a single industry, whether it's fishing, tourism or ports in particular, and then that industry has changed and the town has been left in a sense designed for a previous form of employment.
Professor Witty says poor public transport is an issue too, with many unable to get to health screenings. Chris Thomas from Hastings says he'd need to get 2 buses and walk to his monthly appointments at Bexhill Hospital. Taxis, he says, are too expensive.
When you get an appointment like the 5-minute one, and you think to yourself, God, it's £22 this has cost me for 5 minutes, it leaves you wondering what you're going to do.
Chris Thomas is now getting lifts from the local voluntary group Hastings Heart, and its founder says he's just one of hundreds in need.
I'm not surprised at all by Chris Witty's report. The findings within it reflect exactly what we are experiencing, but these are challenges that we've been dealing in these coastal communities for many, many years, and we've been trying to flag them up as issues that need to be dealt with.
Professor Chris Witty's report says towns like Hastings have got more in common with Blackpool and Skegness, 200 or 300 miles away, than they do with their own inland neighbours. He says governments have overlooked them, focusing instead on inner cities and rural areas. Coastal towns, he says, now need their own dedicated health improvement plan. The Hastings MP has recently been appointed chair of a parliamentary group aimed at boosting coastal communities.
The report says that governments have overlooked coastal towns. We've had a Conservative government for more than 10 years now. That's your party that is all but neglecting its constituents.
I think I wouldn't say it's neglecting. I think what has happened is that there has never been granular data or proper research given to coastal communities.
Have you spoken to the Prime Minister or the Cabinet about these issues?
Not yet. Obviously I've pushed Hastings all the time about levelling up agenda, but it's something that we can really work on going forward, and Chris Witty's report does give us a very good basis to do that.
For now, community support is vital. This food bank says it's had its work cut out delivering parcels to people like Tracy, who can't always afford nourishing meals.
Nice one, thank you very, very much.
I have sat there in my front room, I've just cried because I haven't been able to pay my rent, I haven't been able to pay my bills. It's like I said, it was like between one or the other. I've always tried to feed my kids, Sometimes I go without still.
The government has recently created a new Office for Health Promotion, which it hopes could make a positive difference. But for now, Emily, Jonathan, Chris and Tracy say they'll continue to rely on the goodwill of their community. Charlotte Wright, BBC South East Today, Hastings.